transcription come up? I will start. Okay, here we are. Continuing Allied Health Week, we are very excited to host this session today. My name is Deneen Diamond. I'm here from the lead for the Center of Excellence for Health. We have Chelsea Crockford and Tracy McGrath here today. And I'm just going to do a quick little intro. Recreation therapy uses leisure activities to promote recovery from illness, injury, or disability. Therapy in the form of recreation therapy helps people rebuild their skills, improve their mood, enhance their quality of life, and strengthen and develop positive social connections with others, creating a positive impact on the person's overall health and well-being. Again, very excited to have Chelsea and Tracy. They are experts here from Horizon Health. We want to say thank you so much to Horizon for providing these experts, and I'm going to hand it over to them, and super excited to hear about your career and how you have landed this beautiful job.
Thank you so much. Hello, everybody.
Thank you.
So happy to be here. So I will go ahead, and we have a presentation planned for you guys. So I'll just go ahead and share my screen to get us started, and we'll share a bit about who we are and a little bit more about what we do. Perfect. All right. You can see my screen okay? Lovely.
Perfect.
So, yes, just as our introduction, so I'm Chelsea and Tracy.
I'm Tracy.
So before we get started, a little bit of background, I guess we can just give a quick background in terms of what got us here and who we are. So quickly, I'm Chelsea. I work at in Fredericton here in New Brunswick at the Stan Cassidy Center for Neuro Rehab. So I work mainly with inpatient adults who've had strokes, spinal cord injuries, brain injuries. And my background started off working in long-term care, and I moved here from Quebec. I studied at Concordia University in recreation therapy, and yeah, I just networked and somehow got me here in New Brunswick, and I'm loving the East Coast. So I'm happy to be here. I've been here close to 4 years now. So that's a little bit about me. And I'm personal interests, love hiking, love the outdoors, strong advocate for that. So that's me.
Hi, everybody. I'm Tracy McGrath. I'm based out of St. John. I hold many titles and many roles, but I'm the regional clinical leader for recreation therapy for therapeutic services. Horizon has recreation therapy in therapeutic services, mental health, and at Stan Cassidy. So it's a great pleasure to be able to collaborate with Chelsea today to present about recreation therapy as a whole from Horizon. I still do some clinical recreation therapy work as a recreation therapist here at St. Joseph's Hospital in St. John. The patient population that I work primarily with are those people with a new diagnosis of a dementia, or perhaps they've had their diagnosis of dementia. And my niche really is being carved into working with people who have responsive behaviors that are secondary to their dementia diagnosis, and working with them throughout their journey of their dementia with the patient, with the family, and how to bring them both together to maintain that quality of life. I've been here at St. Joseph's for the past 25 years. I'm the dinosaur around our team now, and I'm so happy to have Chelsea, who's brought all this new persona to our presentation today, because I was an old school PowerPoint presentation. So I'm happy to let Chelsea run the reins for us today, and she's got all kinds of great, unique things that we're going to experience together. So welcome. We're glad to have everybody. Please feel free to ask questions and engage with us in the different things that we have throughout our presentation. So I'll let you take it away, Chelsea.
All right. Thank you. That's exciting. So hopefully you're here today, again, to dive a little deeper into understanding what recreation therapy is. Maybe you have no idea what it is, or maybe you have some kind of idea but want some clarification. So just to kick us off, to really understand, for those who are with us live, to have a little understanding of if what comes to mind when you think about recreation therapy, for us to have a good idea in terms of who we're talking with today. So with your cell phone, as I'm sure everybody has a nearby, you can just go to www.menti.com and it's going to ask you for a code. So I'm just going to go ahead and stop sharing and bring you to the code that you need. And at the same time, I'm just gonna, if that doesn't work, I'm just gonna go ahead and put the link into the chat as well, because we never know with technology sometimes. And so I'm just gonna put the link there. I'm just gonna share my screen. All right, so you should be seeing this right now. Let me know if you don't. So if you're looking for the code, it's up here on the screen, 39580551. And it's going to ask you can put up to 3 answers, I think. And then as you enter the words that come to mind about recreation therapy, they should be popping up here on the screen. And so it's kind of an automated response. And so hopefully that works out for you guys. This is I've seen this used in the past for presentations, and I absolutely love the interaction, and I'm a big visual person. So hopefully you are too. So I love what's coming up: rehabilitation, movement, practice, fun, exercises, real life scenarios. Yes, definitely. Lots of teamwork, that's for sure. These are really good answers. So nothing too surprising or out of the ordinary, I think. So I'm glad to see that some people are on the same page. So that's great. Thank you for everybody who just put in their answers. There's definitely going to be more. So just to kind of make it a little more engaging for everybody. Lovely. So to head back to our presentation here, you're definitely on the right track in terms of what recreation therapy is. It's definitely seen as a fun engagement for sure, just because it's whoops, sorry. I'm dealing with 2 screens, which I'm not used to. So recreation therapy, again, it definitely has fun in the name and what people think about. Definitely more so given that we're focusing on recreation. When we think about recreation, I mean, it's pleasure, what brings us life. But, somebody mentioned teamwork, somebody mentioned, rehabilitation. Definitely that's an example of where somebody can work. But really, when we're looking at recreation therapy too, is really person-centered. So it's all about the person first. Anybody who comes through our doors, they have specific needs, they have specific passions. Who are they as a person? Do they associate with being a parent, a sister, a sibling? What does that look like for them? And figuring out what lights their fire and helping them attain that. And so just a small example too, we can all do the same activity for different reasons, and getting to know that person and what motivates them is really important. Just a small example too, if somebody's seeking social connections and is really not knowing how, if we set them up with volunteer opportunities, and that's their main purpose. But if they meet another volunteer, they're not there necessarily for the social connection. They're there because they have a personal need to help others. And so that's just a small example in terms of what's available, all different motivators in one activity, and really making it geared towards that specific person. Overall quality of life. Somebody, commented of real life scenarios. Definitely, we're looking at what does it mean to have a meaningful quality of life for you, and enjoyable. The fun keyword that popped up there is really, at the end of the day, the purpose of a recreation therapist is really to enhance the quality of life of a person. And it's a healthcare practice that's really rooted in resuming an enjoyment of life, whatever that may look like for somebody. By following, we'll get into this more, but really by following some evidence-based practice, where there's value in offering activities, but with recreation therapy specifically, keyword therapy here is it's rooted into well-founded research where there's specific intervention proved effective for specific with specific modalities, with looking for specific outcomes as well. And so when we're looking at specific outcomes, I mentioned, for example, that I work with people with brain injuries. And so if some people are affected with their brain injury by not being oriented to a place, but they respond beautifully to music, well, there's neurological music therapy, for example. There's a lot of techniques used by using a song to help with orientation. So it's really, we're focusing on an outcome of being for orientation, but using leisure and music as a means, and it's really proven very effective. And I've seen that firsthand. So it's really exciting to see those things work out in that way for sure. Providing choice is huge. Again, like Tracy mentioned, dealing with people, either if it's something new to them or things become a little more complicated. Unfortunately, people have a sense of loss of control, loss of choice of what they can and can't do. And so really the goal is to give as much power and control back to the person whose day-to-day can sometimes often be planned for them by others, which is unfortunate, but then we provide that room for opportunity. And lastly, breaking barriers. Unfortunately, with any kind of disability that people face, there might be some isolation. Maybe some of their goals are related to their physical, emotional, or social sides. And so the focus is really, how can we make it as inclusive as possible, whether it be through education, through sampling a lot of things, and really doing what we can to help them live their fullest life and exploring that all together. Lovely. So back to our cell phones. I'll get you to go back to the menti.com. And we got another question before we jump ahead. And the code up here, 39580551, is your next one here. And I'm gonna just put the link if that's helpful for anybody. So Tracy and I already gave you a few ideas in terms of where we can work, but there's many other places. And so long-term care home, yes. In the workplace, yeah. Privately, for sure, there can be private practices, in a gym, at home, yeah. In the community, that's a huge need. A wellness center. Yeah, these are great. So it's nice to know that I know a lot of people, even for me, when I started in my studies, I had no idea. I was like, what? You can work in the community? You can, sometimes a lot of research that's out there maybe on a specific cohort of population. So it's kind of nice to see the possibilities. So I love that you guys seem to already be aware of all the different possibilities. I love it. Thank you for all the answers. This is great. It's the small things that are just nice to change it up a little bit. Awesome. So perfect. So that being said, I mean, you guys checked the list off pretty good. Hospitals was mentioned, rehab, long-term care. There are some day programs as well that exist, that people do live in the community, but come in just for a day for some specific programming, supported living. So there's also mental health and addiction services as well is another population that we're involved in. Child services, there's a pediatric unit as well, and at Stankasty, for example, that my coworker works with children, and that encompasses adolescents as well. We are involved in correctional facilities as well, some schools, and generally in the community, and as you mentioned already, private practice. So it's a quite a bit of a long list. And again, there's definitely some one-offs as well that some people it might not be your regular practice, but some people get great connections and are able to be involved in a lot of places. So long list, a lot of opportunities there for sure. And it's a huge collaborative effort, that's for sure. So this is always a fun. Tracy found this one and I absolutely love it. It's just kind of a lighthearted imagery of what friends, family, and society thinks you do, your clients, and what you think you do. But as you can see on that last end, it's so much more than just the basic play and participation. There's so much involved in a lot of our interventions. And so teamwork was mentioned in terms of what makes people think of this, and we're definitely very collaborative in our efforts. We're a huge team working with occupational therapists, physiotherapists, psychologists, speech language pathologists, nursing. It's really a lot of the teamwork. And so there's also, as mentioned earlier, we take a clinical approach to providing our recreation therapy services. And so it's not aimlessly somebody coming in and saying, I have a problem with the word bored. There's no problem with being bored, but we do not cure boredom. It's anybody who has any specific goals, getting back to their quality of life. We have a process that we follow, like any clinician, right? We have to assess, we have to plan what that might look like, trial and error of what those interventions might look like. And, again, utilizing a lot of the evidence to inform interventions and then evaluating if it's successful or not. And like every patient that comes through, doing our documentation, making sure we're all doing our due diligence. It's the same across the board with all the other therapists of how they're doing their job. And there's a lot of reasons why recreation therapy works, but just to name a few here, we really use a strength-based approach. And so what that means is we use the skills that you already have, especially in a hospital setting. It's hard to focus on that at times, given that you might have people have a lot of specific goals. They really want to improve a lot of their things. And oftentimes the focus isn't what's working, it's what's wrong, let's fix it. And we have a little spin on that, where you're still the same person that you are. It doesn't change 100% the person that you are. And so sometimes people give up those meaningful activities because they think they can't do them anymore. And so, for anybody, for example, who might have a weaker lower body from an injury, and then might feel discouraged not being able to return to their regular sport or be as physically active as they were before their injury. Well, maybe we can introduce what pair sports might look like, what adapted sports might look like. And similarly to anybody who their hands might be affected, it's looking at how can we use still what you have. Somebody with a lower, weaker lower body doesn't change their upper body strength. So using that as an opportunity to focus on their strength there and explore how can they still be competitive, how can they still exert a lot of their energy in exercise. And so with that, they have an increase in independence. Our services also help combat can help combat loneliness and depression. Again, by working through with our psychologists and the team, teaching and showing the value in terms of remaining active and people maintaining their physical and mental skills. It really can boost their health and overall sense of well-being. And this keeps, again, loneliness and depression hopefully at bay. But even then, it's checking in and realizing that, just to think about the last time you engaged in something enjoyable. Do you feel worse or better after you engage? So that's a perfect example of how that may help somebody's mental health. We're not only physical beings, if our mental health isn't tended to, it makes it really difficult to attain even the other goals. So that's always as important. It also helps relieve stress. Spending time doing something you enjoy releases endorphins. There's a lot of research around this. And having releasing those endorphins has a calming effect, and it does reduce stress. And so lots of evidence there for sure. And just an idea in terms of examples of interventions and why they might work. And so I mentioned briefly the music therapy part. We talked about reducing stress, and even pain is a huge part, definitely with some injuries. And so a lot of the times having that distractibility, having that positive engagement definitely supports this. And I mentioned, getting those happy hormones flowing through your body is great. I mentioned how this is helpful for orientation and even memory, working with different tempos and beats. And some people even use it for some physical activity as well. I know I've seen that in some long-term care facilities, which is great. Technology is huge. It's ever changing. For ourselves, in our facility, we've used virtual reality, helping people after spinal cord injuries still be physically active, following what's recommended after an injury. If somebody goes to their physio, they recommend exercises. More often than not, I don't know, it's kind of common where it's, oh God, I have to do the same exercise, same repetitions. Well, it can be as valuable to find something that brings the same benefits, but you're more motivated. That's the whole goal, is what's important to you and how can we maintain the longevity of that engagement. And again, with technology, you're working a lot with your fine motor skills. If somebody was a gamer before, and their hands might have been affected, practicing those common movements. And again, it's all about returning to normal life and getting back to what's important. Another example would be aromatherapy. Our senses are really powerful things. And so oftentimes, and I'm sure Tracy could talk to this a lot, experience working with dementia patients, but how even a sense of smell can link to memories and positive emotions. And so this type of therapy is particularly calming for seniors with dementia or people with brain injuries as well. And we talk about physical activity as well. It's all, when you look at the big picture, they're just activities. It might look like we're just having fun, but behind every activity there's a goal and a purpose behind it. And so a lot of focusing on people wanting to increase their strength, improve their mood and coping, improve a lot of the different types of symptoms, and their independence. So as you can see, there's a wide range. And so we do a lot of our consultation, our assessments, and our interventions related to, managing the positive response behaviors, getting back into the community, a lot of education and counseling, we call it leisure sampling. So trying a lot of things all together just to get back to that sole purpose and goal. And so there's a lot involved, that's for sure.
Chelsea, we had a question in the chat. It just says, what is the difference between OT and recreation therapy? And that might be something that somebody's going to talk about later on, but just wanted to know, I wanted to let you know that there was a question there.
Yeah, that's a great question. We don't really dive too much into the difference with other disciplines, so I'm happy to address it unless you wanted to address that, Tracy. Really, occupational therapy, I don't forget where I read this, but there's a really good saying, is to kind of put it in concrete examples. So a physiotherapist will actually help you gain the strength to get out of bed. Your occupational therapist will help you what to do once you get out of bed and get ready. And your recreation therapist is going to help you do with what do you do once you get out of bed, how to pursue that. I'm kind of I might be botching it and paraphrasing a little bit, but the idea, the example with occupational therapy is they're really focusing on your day-to-day self-care tasks. Really those functional parts of your day of being able to get out of bed, dressing yourself, feeding yourself, cooking a meal, getting back to work. A lot of those, we call those just more like, activities of daily living, and a lot of more of those functional parts. Where recreation therapy, we have more of an expertise focusing on the leisure and recreation side, where we might be supporting those goals. Somebody might not always be motivated to feed themselves if they're working on some upper extremity. Well, if they're, an avid card player, if they're an avid, do arts and crafts, and they work with tables a lot, working on those same movements of reaching, and by engaging in an activity that they might not even realize that's what they're working on. Sometimes that's the benefit of rec therapy, is sometimes the clients kind of forget that part. I don't know if that's clear, or you have anything to add, Tracy?
I think I have a very good friend of mine who is an OT, and we work collaboratively together. And I will always say the occupational therapy is really focusing on the function and improving the function of the person. And then I'll come in and say, and recreation therapy is putting the fun in the functional. So all of our therapies are using leisure as the modality or the therapy to help improve that person's function. So it's really, because I'm very much a sport-minded person, I think of physiotherapy, occupational therapy, recreation therapy as the interlocking rings, like the Olympic rings. We all stand alone, but we all work collaboratively together. And certainly where I work here at St. Joseph's, we work, and for Chelsea, we all work as part of that interdisciplinary collaborative team. So there are very many similarities, but there are differences when you fine tune out to exactly what it is that we each do, mm-hmm. and the role that we play.
Yeah.
But otherwise, great job, Chelsea.
Thanks. No, that's a great. I love that saying too. Hopefully that answered your question. So I'm going to go ahead and pass it along to Tracy here, and then you just give me the signal when just give it.
Awesome. Thank you. So we're going to look a little bit and delve into a little bit about what's the difference when we talk about recreation therapy. I always call it, there's two streams. And I talk with my hands, so you may see my hands in and out of my screen. I apologize. So we have recreation therapy, but then we also have recreation and leisure-based services. So when we look at recreation therapy, that's the first piece that we do in terms of the recreation therapist is going to be doing the assessment with the patient or the client. We're developing those intervention plans. We're evaluating that client progress. And this is the unique feature of recreation therapy that is going to make us different from some of the other therapies. And that's using these recreation modalities as part of their therapy and as part of their individual treatment plans. We are going to individualize all of our modalities that we use to the person. Chelsea mentioned earlier, it's all about the person first. It's understanding who the person is before understanding what the disease is, so that we acknowledge people by their name, not by their diagnosis or their ability or their change in ability. And even focusing on what their ability is rather than what their disability is, because it just changes the context of how we look and view at these people, because they're people first. We look at people in terms of what is their past and the impact of their past on them in the present day. What is their present day? What are their abilities that they have now? What are their future interests? Just because someone has had a stroke or a brain injury or a new diagnosis of a dementia, or they're told they're not allowed to drive their car anymore, what are the things that they still can do? Because they still can achieve quality of life. They still can participate, but sometimes they have to relearn how to have fun, is how I kind of put it in a simplistic measure of, it's hard to relearn how to have fun when we're not able to do things in the same manner of how we used to do them. A recreation therapist has a very unique perspective in terms of looking at the social needs of the person, the cognitive needs of the person, their physical needs, and their leisure needs, and then bringing all of those pieces together. We're going to incorporate all of their interests. We incorporate their family and their community in terms of making that therapy process both meaningful and relevant. The old adage of it takes a village to raise a child, it takes a village for all of us to have a good quality of life because we are social beings. Some people are more social than others, but we depend on others to be part of our circle, whether it's our social circle, our circle of care, our circle of happiness, our circle to maintain our mental health. You can call that circle whatever you want, but a circle needs to have more than one of us in there. We're going to weave the concept of healthy living into treatment so that it's not just treatment, but we're putting that fun piece into it. We're also going to do in the interventions and the programming that we're offering, we're following evidence-based practice. We have standards of practice. We don't do something just for the sake of it. We're not a Band-Aid to boredom. We're very much utilizing specific programs with specific objectives, specific criteria about the program. We have safety and risk management to those programs with very much looking at what the end goal is. We set goals with our patients. We set goals with patients and families so that we're actually achieving success, and we have outcomes that we can measure. The recreation therapist is going to work primarily on the recreation therapy side of the house, if you will. And our therapists, because we have both recreation therapists within recreation therapy, and we have the role of activity worker, which is what Horizon Health Network is currently calling that role, and we're advocating to move towards the new term of a recreation therapy assistant. So we have therapists and assistants working within recreation therapy within Horizon. So our therapists are going to work on the recreation therapy side. They're working in hospital, working with inpatients, we're working with outpatients, and we are improving and maintaining and preventing that decline in the patient's overall health while enhancing their well-being and quality of life through the assessment process, the intervention process, and the evaluation process. We're developing leisure-based treatment plans, and we're utilizing that information from the assessment process to ensure that everything is individualized based on the person's strengths and abilities. It's also still meaningful and purposeful, but it's modified to meet the person where they're at in the moment that it's being offered. I've alluded to already, we work as part of that interdisciplinary team. We work as part of the family. They're part of that patient care or patient-centered care team. And then we are also responsible for the delivery and the implementation of our recreation therapy services. And that's our recreation and leisure services that are offered. And we provide the supervision and the support to our assistants who play a big role and a very important role in our teams to implement what we refer to as I call them our participatory programs or our calendar programs. Those are the activities for just overall engagement, participation, our birthday bingos, our weekly crafts, our weekly sing-alongs. We can have a sing-along that is a weekly sing-along, and we can have a sing-along that we might do with someone on an individual basis. Perhaps it's a person with a diagnosis of Parkinson's and they now have dementia and their gait is changing. We can be doing a one-on-one intervention with them using music because the music is going to help them with their mobility. And that's very different than what one of my assistants will do as a generic sing-along program, focusing on music for the enjoyment and the reminisce and the camaraderie and the socialization. So the same programs can be utilized in different manners and different concepts. Our activity workers and our recreation therapy assistants are going to be the people who are implementing these programs. They're also going to be observing our patients and documenting any changes in behaviors, changes in abilities. And we work collaboratively with our assistants, and there's very good communication that is maintained. So our activity workers or our recreation therapy assistants, they work under our direction, they work under our supervision. So we as the therapists are identifying the treatment plans, and then they're helping us to implement those on a day-to-day basis. And that allows us to spread our service to more people than what we would just be able to do as one person as ourselves. They're delivering our leisure-based interventions. Those are done in both an individual manner, one-on-one, or a small group or perhaps a large group. In hospital recently, because of COVID, most of our large groups are not quite the same as what a large group had been pre-COVID because of different restrictions and guidelines that we now have in hospital. But we are still offering some group programs. All of our interventions are meaningful, they're therapeutic in nature, they're individualized, they're fun, they're purposeful, they're patient or client-centered, and they're holistic centered. Our activity workers are playing an essential role in that program implementation, the observation, the reporting. Our activity workers do not do the assessments themselves. They work as part of our support staff and as our assistant. So that is a big piece for them. So they're able to implement the programs that are identified and the treatment plans that are identified. We have a large collection of volunteers who work as part of our recreation therapy teams, and our recreation therapy assistants have a big role to play there. They're often some of the first connections that our volunteers will have, and they can help set up who it is that we have working with our volunteers. They also play a big role in terms of the safety and the risk management, in terms of identifying all of the areas where our programs take place, making sure that it's safe, making sure that the patients are safe, to avoid any dangerous situations or risk-taking possibilities. And they're doing lots of documentation and communication and observations of the programs that are taking place. I think I kind of rambled on that one a little bit, but I think we're good. All right, if you can flip me forward there, Chelsea. So we wanted to, because we thought that this presentation, or we believe this is going to some of the students, and because recreation therapy is new to a lot of people, we wanted to give some information and background about the two different roles that take place in recreation therapy, because there are different qualifications that support each role. Both of these roles are valid roles. They are very important roles. They're professional roles, but they're different in terms of how you acquire the qualifications that are needed for those roles. In order to become a recreation therapist, the requirement from an academic perspective is actually a bachelor's degree in therapeutic recreation, and that needs to come from an accredited university. Recreation therapy is still a fairly new profession, and when you compare it to occupational therapy or physiotherapy, and we're moving in the right direction of gaining more national-wide certification, but we still have a ways to go. So it's important, if anybody is interested in pursuing recreation therapy, that they ensure they're getting their degree from an accredited university for that therapeutic recreation program, because that is going to benefit the person better in the long run and create better opportunities and open more doors for them. Certainly, we promote and encourage all of our therapy staff to be a part of our Canadian Therapeutic Recreation Association, and that is a membership that anybody can join. So I get distracted when I get emails pop up, so I'm like, oh, I need my little blinders on. There is a qualification that's called a Certified Therapeutic Recreation Specialist, or CTRS, as those in our field will identify as. And that qualification comes through the National Council for Therapeutic Recreation Association. I strongly, strongly encourage and recommend anybody interested in pursuing a career as a recreation therapist that they go the route of becoming a certified therapeutic recreation specialist. It is going to provide you with greater knowledge, greater education, greater opportunities, especially as we continue to move forward. As our role is changing, as the profession is growing, I think that's where new people going into this field, where they really need to focus on. The NCTRC has different specialty areas that you can continue to specialize in and become certified in. So always when I have students or volunteers, that's always my piece of advice, if they remember nothing more from me, is get a degree from an accredited therapeutic recreation program and pursue their CTRS. That will help them to become the best recreation therapists that they can be as they move forward in their career. I'll get you to flip to the next page. I'm not even following my notes, so this is when I get myself into trouble. Horizon does accept internship placements for those students who are pursuing their CTRS, which is the Certified Recreation Therapist Specialist. We have numerous opportunities throughout Horizon in all 4 areas of New Brunswick, where students can communicate with the education portal of Horizon Health Network and request a placement in any one of our areas. And those placements are 14-week consecutive internships. So that's a great thing that not always do all of the students know about that. And I'll get you to flip the page again, Chelsea, please. And
ladies, I'm just being mindful of time. It's about 2:11 right now.
Okay, thank you.
You're welcome. You're doing great. And you're like me, and we need our blinders on all the time.
No, I get distracted. No, you can go back. So we wanted to put a list in. We knew this would be a recorded presentation. This is a list of, at least accurate as of today, of the universities across Canada that are offering recreation therapy degrees, so that students can go to that list if they're interested. I'll get you to flip over. For the recreation therapist assistant, or right now it's activity worker, but we're moving towards the new language of calling them a recreation therapist assistant, which makes them sound much more professional. This is a very important role. The academic qualification for this position is a recreation therapy diploma. Again, very important that it comes from an accredited therapy assistant program. There are numerous different types of social service, human service programs that are available out there, but that's really not the right type of academic qualification if students are truly interested in pursuing the role of a recreation therapy assistant and they're not interested in a university education, because there's bigger financial commitments to that. So again, we want to make sure that we're giving the right guidance. We've also included, no, you can flip. We've also included a list here of, again, as of today, pardon me, my tongue gets tongue-tied as I get talking. We've included a list that as of today is accurate of across Canada, where can someone go to get a diploma in recreation therapy to become a recreation therapy assistant. Most of those programs are 2-year programs. There are a couple of those programs that are hybrid programs of in-person and online. And I believe there's one at Lethbridge College out of Alberta that is purely an online program. So it is good because of COVID. There have been changes in how the education is being provided. So there is opportunity for people if their interest is in pursuing a university bachelor program versus someone who is interested in pursuing a college or diploma program. So we wanted to be inclusive of that. I also thought it was very important here because not everybody wants to go into recreation therapy, and that's totally fine. But there are opportunities to volunteer in recreation therapy and within Horizon Health Network. We have numerous volunteers that come through us that are looking to pursue medical degrees or nursing degrees or other therapy degrees, and we can offer people the opportunity to come in and volunteer and gain valuable patient care experience and patient care interaction, which is a huge piece for any therapist, any professional that's working as part of the healthcare team in hospital. Volunteers are so valuable to so many of the programs that we provide. They can work both with us in recreation therapy and work with us as part of our participatory programs and group programs that we're offering. And they also come in the after hours and work as our friendly visitors. And the impact that our volunteers have on our patients is huge. And without our volunteers, we would not be able to extend as far as we do extend in terms of providing that greater quality, helping people, and just being with the patient. Sometimes it's reading to a person. It could be playing a card game with a person. It could be simply just sitting and holding someone's hand. There's so many different opportunities. I'll get you to flip to the next page. We've also included as part of this presentation the link for the volunteer application form. We've tried to make it as easy as possible. So if anybody is interested in volunteering, they just have to click onto that link, and in theory, it should take them immediately to Horizon Health Network's website, where they can fill out the volunteer application and they're able to identify that they want to work as part of the volunteer team with recreation therapy. I know for myself and for many of the other recreation therapists, we've also written numerous character letters of reference for volunteers who are continuing to apply for further education. So it's a wonderful opportunity that benefits the person who chooses to volunteer, benefits the patient, and benefits us as part of our recreation therapy teams. I kind of sped through that a little bit. Oh, thank you for putting that in the chat box. And I think the biggest thing, I'm a visual person. I love pictures. This is one of my favorite little memes of the student saying, "Professor, what do recreational therapists make?" And the professor saying, "Young man, they make a difference." I can honestly say I have so many memories, so many stories of over the course of my 25-year career. I've been very fortunate. I feel that it's always been a privilege and an honor to have worked with all of the seniors that I have worked with. I've only worked with seniors, and I have so many amazing stories of the impact that recreation therapy has had, not only on the person who was the patient that I was working with, but also on the family. And that's where we can talk about evidence-based, and we can talk about patient outcomes, and we can talk about function and improvement and holistic care. And all of those things are absolutely important. The bottom line, we make a difference in the day-to-day life of the people that we have the privilege to work with. And that is the reason why I do my job every day. It's the reason why I drive through snowstorms to get to work, because the patients are here and they know when we're here and they know the difference that we make. And that really, for anybody who's looking to go into a profession, if you want to make a difference in a person's life, there's many ways to do that in the healthcare field, but certainly recreation therapy is one way that I think is the best way, because I work as a recreation therapist, so I'm very biased on that. But you truly have that contact and interaction, not only with the patient, but with the patient and the family. And there are many ways, as the patients that I work with progress into the late and advanced stages of their journey with dementia, sometimes it stops becoming about the patient and it starts becoming about the family, and how do I help the family interact when they're with their loved one, when their loved one no longer knows that they're there or has that awareness that they're there. So bottom line, we make a difference. And I guess I'll stop talking there, because I could talk and go on and on and on, but it's now 2:20. So
No, I'll stop sharing here. Our slide. That was great. Thanks, Tracy. And we'll leave it open to questions or discussion if we have the time, or if there are any questions.
Yes, of course. We'll open up the floor to some questions, but I do want to say that your passion and your excitement about your profession shines through both of you. And it's so lovely to hear people talk about the power of, I guess, empowering people to, have the ability to do something. It may not be exactly what they were used to, but giving them the power back to them to say, you know what? This is where we are right now, and let's look at how we can make this better. And I've been part of recreation and sport my whole life, and I have family that's dealing with some issues right now. So I do know that the work that you do certainly is something that our system needs, and we appreciate it as consumers. But certainly, I think it's really interesting for students to hear about what it is that you actually do, and you captured that really well. So thank you for that. I will just ask anybody if they have any questions. I have one question. I'm wondering, because recreation therapy is something like, I hear about physiotherapy, and I've had injuries, and my father right now has Alzheimer's and different things like that. How is this part of like an insurance program? Like if I went to my doctor and said I need a recreation therapist, is that something that is provided very naturally, or is it something that usually is only kind of offered in certain circumstances?
I think I can start, and Chelsea, certainly feel free to add anything. At this time, there's not many private practice recreation therapists in the province of New Brunswick. If a person who, and I'm going to carry on using your father as an example, because you shared that he has Alzheimer's disease. If he was living in the community, and I'm going to kind of create some scenarios, if he was living in the community, he could, there's access to some recreation through some of the day programs. Unfortunately, there's a greater need for day programs than what we have available. So that makes it a bit of a challenge. And all of our day programs have some differences in terms of what they offer, where they offer, how they offer, the frequency that they offer of those programs. But there's certainly wonderful avenues for people still able to live in the community, that they can have a place to go where they're able to engage in leisure, recreation, and social-based programming that will be modified to meet them where they're at within their stage in the journey of their dementia. If a person's in hospital, within Horizon Health Network, we have recreation therapists and recreation therapy staff in all 4 areas of our hospital areas. Not all of our facilities have recreation therapy, but there are Fredericton, Moncton, Miramichi, and St. John. We have recreation therapists in all of those areas. Predominantly in our units that would be captured under the health and aging programs. So our assessment units, our rehab units, all that would be focused on geriatric. Some of our transitional care units for those people who are in hospital waiting for nursing home, some of those units do have access to recreation therapy, but it is limited. We are certainly the smallest discipline within therapeutic services, so we don't have resources that can extend to all facilities and all units. In a perfect world, we would, but we're living in today's 2023 healthcare world, and our resources are limited in terms of where we can go. So I hope that answers it a little bit.
Totally answers my question. And I just want to just take note of how you spoke about caring for the family, not just the patient. And I know that that's something that certainly I'm sure is what you folks deal with on a day-to-day basis. And it's so I guess warm to hear that you're not just speaking to the patient for the patient. It's looking at that wraparound kind of support that's needed from even, having that therapy session is going to offer respite to the caregiver and those types of things. So it's all encompassing, which is so lovely. So thank you. If there's no other questions, I think we'll probably sign off, ladies. But I am going to stop the recording, but that was so lovely. Thank you so much. I know you put a lot of work into that presentation. And if you want to share the presentation my way, I can certainly post it with the website link as well. With the once we post the recording, it's always nice to have that PowerPoint for teachers, but that's up to you. But from the Center of Excellence for Health, I would love to say thank you so much to Horizon Health and our experts today, Tracy and Chelsea. You have been absolutely lovely, and I know the students will really appreciate the very in-depth conversation around what recreation therapy is and what you folks do. So thank you so much.
Thank you very much.